Okay, Lauren, you're on tape.
So, I wanted to make this presentation to inform you about me. I think you all know that I'm different from everyone else, and I just wanted to let you know how and how you can prevent something.
Just to educate your friends.
Just to educate. So, All About Albinism by Lauren Hustis. This is me, my brother, and my sister. Do you see any difference in age?
Yes.
Anyone? Charlie?
The hair?
Yes. Very much so.
2 blondes and a brunette.
What is albinism? Albinism is a genetic condition. That means your mom and dad pass it down to you.
Oh!
Go back to present. Right hand side.
Where?
Right there.
Right there.
Upper right.
Jumping.
Right here.
Right here. Oh,
Right here. It says present.
Present.
Where it says present.
Woo! Problem solved.
Albinism is a genetic condition that means your mom and dad pass it down to you. Albinism prevents people from producing pigment in their hair, skin, and eyes. Pigment is what gives people their hair, eye, and skin color. It allows people to tan in the summer. That's why my hair and skin is so lightly colored. My body does not produce pigment like everyone else. Albinism and vision. People with albinism have vision problems that are not correctable with glasses. My glasses help with my vision problems not associated with albinism, like a normal astigmatism and nearsightedness that many of you have. So some people think, oh, you have glasses, everything is fixed and you can see fine. No, some of you wear glasses just because you cannot see as well. That's why I do it, but my optic nerve did not develop properly. So that glasses do not help with the vision inside. It just helps with the vision outside. My retina is not developed properly, and the optic nerve connections between my eyes and brain are not like everyone else's. This causes an uncorrectable vision problem. So no, if you look at me and say, oh, you're wearing glasses, everything must be okay. It's not. It doesn't really fix anything.
It helps a little bit, but not a lot.
It can't correct it.
It can't correct the, deeper problem.
So at my doctor's office, she has a special machine that can take a picture of your retina inside. This is what many of you look like inside your eye, your retina. All of the pigment inside your eye covers up all the blood vessels and nerves and veins. So, and then this is mine. Looks kind of different because of the lack of pigment in my eyes. You can see everything, and that's why things look brighter to me.
Kind of like you can close the shades in the classroom. You guys have shades on your eyes. You have color in your eyes. You have pigment. Lauren doesn't have the color of the pigment, so it's just an open window to her with all the sunlight coming in.
Let's see if it works. It does.
Yay! Okay, you guys may have noticed this with Lauren before.
My eyes wiggle back and forth. Just so you know, I cannot help it. I have no idea when it is happening.
And now can we get back?
You have to press the
Push the.
It's all the way
Okay.
up.
It's all the way up there.
It's all the way
Okay, wait, what is it?
Somewhere.
I know, but where?
Left, to the left,
all the way to the
left.
left,
Press
on
X.
the
This-
bottom,
Do not
bottom
press
left.
X.
The bottom left corner.
Bottom.
Right there.
Okay, it just goes replay. Oh, we get to see it again. What's it called, Lauren?
Nystagmus. Just so you know, I have no control over it. It does not affect my vision. My mom always knows if I'm tired or not feeling very well because they wiggle more. So if they're wiggling more, she always asks me, are you okay? Are you tired? Are you feeling okay? Are you sick? And I always say no, unless I am, because I have no idea when it is happening. I would prefer if you do not point it out, because in the past none of you have, but people have called me weird because of it and asked what is wrong with me. I can't. do anything about it.
Yeah, it's all associated with albinism and her optic nerve being developed and a bunch of different things.
So I would just prefer if you didn't point it out.
Okay, Mike, go back to the video.
Yep.
Yep. Remember, we have to hit on the bottom slide.
Okay, what do we have to do?
Click the tab.
Yeah.
Okay, now just hit next slide. I think on the bottom you can do it.
Yeah.
Bottom left.
hand.
There it is.
Okay, click that.
Do you want me to? Hey, Lauren, I got it.
Yeah. Thank you.
All right.
Sensitivity to the sun. When I go outside, I always have to wear sunscreen. Because of the lack of pigment in my skin, I only burn. I cannot tan like many of you can. And because of the lack of pigment in my eyes, as you saw with the retina pictures, everything looks brighter, especially the sunlight though. That's why when I'm outside it looks like I'm wearing sunglasses. They transition, so that's why. How I see, we call this 20/20. This is how many of you probably see. When you're driving down the road, you can read the street signs, you can read the license plates, you can read all the signs on the buildings and stuff. But with me, we call this 2200. This is about how I see. I can see the buildings, I can see the grass, I can see the cars. I cannot see details. So I cannot read the license plates, or I cannot read what is on the sign. So if I ever ask you like a little detail about something, like what things say on the board or something, I'm not trying to annoy you. But,
Just needs a little help.
yeah. So, if you call out to me from across the playground and I do not wave at you, I do not do anything, I am not trying to be rude. The point is I don't know who you are. I cannot see that far. So I can see your body. I cannot see the facial features. I might not know who you are. So if you walk into a room, this is how you see. If you point someone out, you can see their face, you can see their eyes, you know who they are. But I'm in the middle of these two. I walk into a room, I can see everyone, but I don't know who they are.
You can't see the details of someone's face.
So what I do is I do everything pretty much on their voice and what they're wearing that day. So if I see you in the morning with a bright blue shirt, that's what I'll look for. I look for colors.
So don't go changing clothes with your friends. She'll call you the wrong name.
I did that. I've done that before. I called someone else.
Yeah. Give them a little hint, like what they can do to help you if they see you at the park pool or something.
So I'm using examples here. If Ellie sees me at the pool, she can say, "Hi, Lauren, it's Ellie." Use your name so I know who you are.
Yeah. And it might seem weird addressing yourself, but that's going to help Lauren, know who it is, because since she can't see you, just quickly say who you are.
Your name.
Yeah, and she's not being rude at all. She just can't see who you are from a distance.
So, this is how you see. You can go from 18 all the way down to 6 text size, and it's fine. But when I get down to about 12, 10, it gets all blurry, and I can't read it. So that's why I always need my paper blown up. Devices to help me see. This is called a magnifier. Everyone has probably seen me using it. It makes the text bigger. This is a slant board. It brings the paper close to me so I do not have to bend down. This is a binocular. It is exactly like binoculars, but there's only one of them. And then I do not have this. $2,000, but I want one. It's called a bioptic, and it hooks onto a pair of glasses. And the reason I want one of these is with that I can finally see how everyone else sees. I have dreams about how you guys see, and I imagine everything huge and sparkly. Huge and sparkly. That's how I imagine everyone else's vision, so that's why I want one of those.
Yeah. Lauren recently tried a bioptic at her eye doctor, and she came home and she said, "Mom, is that how you see all the time?"
What am I missing here, people?
Yeah. She's like, "I've really been missing out on a lot, haven't I?"
Yeah.
It just feels like I miss out after I try that on everything was huge. Am I missing out on anything? Albinism versus albino. Very important. The correct term for my condition is albinism. I am a person with albinism. Many people know this as albino. There are many people that do not like to be called albinos. I am one of them. I do not like this word because it often has a negative meaning and most people do not fully understand albinism. I'm just like everyone else. Please do not call me names and please treat me like everyone else. No albino equals happy Lauren. You always want me to be happy. I'm not happy. So the reason I don't like it is because in some Hollywood famous movies, the villain, they call it the bad albino, and they always have bright red eyes, and I don't want to be known as the albino girl. I do not want to be known as having red eyes or anything.
There are some people with albinism that don't mind the word, and some people don't like it. So it's a personal preference, what people like and don't like.
I would just prefer. Who can have albinism? People of any race or culture can have albinism. Animals can also have it, as you can see. Any animal can have it. I like giraffes, so I can have it.
And most animals with albinism do have those bright red eyes, but people do not. Sometimes people have a little bit of a purple tint or pink tint to their eyes because they don't have the pigment.
NOAA, the National Organization of Albinism and Hypopigmentation. Every 2 years, my family goes to a national conference for people with albinism and their families. Approximately 1 in 18,000 to 20,000 people have some type of albinism. At these conferences, we have lots of friends. A few years ago when we went and we left, my brother started crying because he said he felt normal there. I like these conferences too because I get to see everyone like me. Around here, there's not very many people like me. Thanks for learning all about me. Does anyone have any questions? No?
Quinda.
Oh, Quinn.
What made you come up with this idea?
Well, at Parcells, I wanted everyone to know about me, and some people think I'm weird, so I just thought everyone could kind of tell them no, because you're all my friends and I trust all of you, so I just thought you could kind of stand up for me at Parcells.
Yeah. And we want to educate people so you know more about it.
Anyone else?
You have a question, honey?
Yep.
So who else in your family has albinism?
Just my brother. Before my brother, my mom didn't even know it existed. Anyone else? Elise?
Did you show the other classes this?
Yeah. Before you guys.
Maybe right now?
Well, I guess that's it. Thank you.
No, because
Good
Lauren,
job.
if someone's You guys, I wanna, and I know Lauren would never say this, I had Ryan also. That's when I first learned about albinism and really what it was. Teasing, the jokes, the people pointing out and saying things, that really hurts their feelings. Just like it would you if you came to school and you had a big bruise on your face and everybody drew attention to it. So you guys need to help, I don't want to say defend, but
Educate, stick up for.
you know, if somebody says something, if somebody makes a comment, don't just say, you know, laugh or get mad and go and tell someone, turn and tell them, well, do you know about albinism? And if they don't, then explain. Because the only way you know is if someone teaches it to you. Am I right?
Mm-hmm.
just like everybody else has something. We just happen to be able to see Lauren's. How many people have allergies? Same thing. We just can't see them. Except if your eyes swell up and. But do you understand what I mean? Okay, Lauren, I'm highly impressed.
Do you have any questions?
I always have questions, but that's okay. Is it getting better with people?
Yeah, kind of.
Yeah, but Parcells will be a whole new group of people, and so that's why she really wanted to educate her friends here. People she can trust, people she's known for years.
Especially because Ryan's not there anymore.
Yep.
And the people who, knew Ryan were,
Mm-hmm.
so.
All right.
Yay for you. Proud
Okay.
of you.
Thanks, Lauren.